Good evening and thank you for joining us. Before we get started, I wanted to share a few brief housekeeping announcements. First, I would like to thank everyone who submitted questions in advance of tonight's town hall. We hope to address many of your COVID-19 vaccine questions over the next hour with our panelists. If you have additional questions or need clarification, please use the Q&A function in Zoom. As a reminder, this is a public forum, so anything you type will be visible to others. Tonight's town hall is being recorded and streamed live on Facebook. Please feel free to share the link so that others can tune in and watch. We will paste the Facebook Live link to this event in the chat momentarily. And finally, a recording of tonight's event will be available on the Montgomery County YouTube page, and we will also send that link out to everyone who registered tonight once the video is uploaded. Now I will turn it over to Montgomery County Commissioner Ken Lawrence to kick off our town hall.
Good evening, everyone. Thank you for joining us this evening for this important town hall meeting. I'm Ken Lawrence. I'm Vice Chair of the Montgomery County Board of Commissioners. I'm going to try to act as the moderator tonight. I have 2 doctors and 3 preachers, so it might be hard for me to wrangle that, but I will try to do so. First, in just kicking it off, I'm going to ask each of our panelists to just give a brief introduction of their role, and then we're going to get right into the questions. Okay, I'll start with my colleague, Dr. Arkoosh.
Good evening, everybody. I am Dr. Val Arkoosh, Chair of the Montgomery County Board of Commissioners, and so glad you could join us tonight.
Okay, Dr. Stanford.
I'm Ayla Stanford. I'm a pediatric surgeon and founder of the Black Doctors COVID-19 Consortium.
Pastor Mitchell.
Marshall Mitchell, pastor of Salem Baptist Church of Abington.
Pastor Kwan.
Charles Kwan, pastor of Bethlehem Baptist Church in Springhouse.
And last but certainly not least, Pastor Waller.
I am Alan Waller. I'm senior pastor of the Enon Tabernacle Baptist Church in Philadelphia.
All right, and thank you all for being here this evening. So let's jump right into it. As I said, we have had questions that have been submitted, so we're going to get through as many as possible. Anyone can jump in, but some of these questions I will direct. I'm going to direct this first question at Dr. Stanford. Dr. Stanford, is the vaccine safe?
Yes. Okay. Yes, it's safe. The ones that have been approved for emergency use from the FDA for the prevention of coronavirus, that is the Pfizer vaccine and the Moderna. I've read the studies. I listened to the hearings. I believe that they are safe. I had the Pfizer vaccine, my first and second dose. I'm currently administering the Moderna vaccine in the Philadelphia County, and I do believe it is. And I think every person has to ask, is it more risky for me to contract coronavirus, or is it more risky for me to take the vaccine? And for the majority of people, it's the latter. It's safer for you to take the vaccine than to contract coronavirus, because you don't know if you're going to be the mild asymptomatic person, the person who's in the hospital, or the person who doesn't survive. And so that's how I would explain it.
Okay. What about if you've already had COVID? Should you still get vaccinated?
So I had COVID in August, and I did take the vaccine. I can say, and this is anecdotal and talking to lots of folks, that when you've already been exposed and your immune system has already mounted a response to the virus, your side effects from the vaccine tend to be more intense. And so since I already had COVID, when I got the first shot, for a good 48 hours, I did not feel like myself, headache, queasy, achy, and so forth. After the second dose or the second shot, I definitely felt worse. But again, it was 30 hours versus other people who did not have COVID. They did not have the same response. But I'll tell you, that let me know that my immune system was generating memory cells, antibodies, so that when I'm exposed to coronavirus again, and I will be exposed to it again, that I have some protective cells to keep me from getting sick.
Pastor Mitchell, I know you've been vaccinated as well. Did you have similar side effects? Now, you have not had COVID, but you got vaccinated. So can you talk about your experience with the vaccination?
Sure. And the reason I was vaccinated and the reason I trusted the science was because I trust and know and love Ayla. She belongs to my church. So that's why I had the confidence level. Our symptoms were very similar. Ayla and I speak often, and we were on the phone. How you feeling? How you feeling? And I felt for maybe 23, 24 hours like I got hit by a ton of bricks. I had chills one day. I was lethargic, but when I weigh how I felt momentarily versus the protection that I believe I have now, I would do it over and over again. So I did it with confidence. I did it with faith. And most importantly, in this instance, I did it with a science and a friend who I believe is insightful in these things.
Val, if you take the vaccine, will it eliminate your chances of getting COVID?
Well, here's what we know about the vaccine so far. And we know a lot, but we do need to acknowledge that these vaccines have not been in use for a real long time. But what we do know so far is that these two vaccines that Dr. Stanford mentioned have been 100% effective in preventing people from going to the hospital, and also 100% effective from preventing people from dying from COVID. So those are two great outcomes. It's possible that people could still get a very, very mild case of COVID, but you probably wouldn't even notice it or just think that you had maybe a mild cold. But those key things, a severe case that would send you to the hospital and perhaps cause your death, the vaccines have been 100% good at preventing that.
Okay. We titled this forum "Facts, Not Fear." We probably need to have another F in that, and that's faith. Facts, not fear, and faith. And this came about because our NAACP branches, we were brainstorming with them how we could talk to the African-American community about this. And they actually suggested and named the three churches and the three men that we have here. So can I ask each of the pastors just to talk about why you're here and why you feel this is important for your members and the community?
Mhm.
Well, Ken, let me start by saying, since you said I was the oldest person on the panel.
I said senior, Pastor. I said you were the senior.
But I took the vaccine. I didn't have the virus. I did consult with my primary physician. About 5 years ago, I had 39 days of radiation that resulted in prostate cancer. About 3 years ago, I had a pacemaker put in, and all of those steps were steps of faith. And I happen to believe that the vaccine was good for me. I've not had any side effects. I will take the second shot on February the 13th. And so I've had preconditions in terms around health, but my faith in God has allowed me to be energetic. I've not had any side effects from the radiation or, from that matter, from the pacemaker. So I'm still energized and still feel. I sat in the Jefferson Center about 15 minutes and I didn't have any side effects. And since then, I've been fine.
Okay. Pastor Waller, would you like to speak to that?
Yeah, I'm participating, quite frankly, because I trust Dr. Ayla Stanford. From the very beginning, she has been fighting this fight, and I locked arms with Ayla and Marshall to make sure that there was testing. And so I want to make sure that people are comfortable, that they're getting the truth about the vaccine, and that we recognize that on some level, some of this is also experimental, and we have to acknowledge that, but it's the best experiment that we can take in order to get our community healthy and to get our world healthy. So I'm involved with this to make sure that people understand what it is. And also, I'm somewhat of a guinea pig right now. And that is, I had it, I have the antibodies, and I am being frequently tested for the antibodies because I think that all of us have to participate in helping the medical industry understand my understanding of their testing me for the antibodies and others. is to understand the life cycle of antibodies in bodies that will even inform this vaccine to help answer questions as, is this going to be something we have to continue to do? So my message to the community is we all have to participate, get in where we fit in, trust trusted messengers with a trusted message, because it's not just about your own personal safety, but we are all participating in making this a better world so that this whole coronavirus COVID thing goes in the polio category for our grandchildren. It just is a non-issue. So I think that is why we all must participate.
Ken, I would add to that. I don't think this conversation is about the elimination of fear. I think that would be unfair to people who, particularly African Americans, who have been Black their entire time in America. How could you not be fearful? How could you not be wary? How could you not be leery of something that is killing us at a heightened level? And then to know that we have been at the lowest rung on the ladder socioeconomically and with respect to the availability of healthcare for us. So I think fear is an absolutely legitimate emotion for people. And I think we would be doing the history of America a disservice right now if we simply ask people to not be fearful. I think people should be guarded. I think they should be cautious. I think they should make up their own mind. And I think they should listen to people they trust and listen to people who are insightful. I think fear also is very legitimate because the under 60 crowd that I talk to, let's say under 50 crowd, I just bumped into the 50 age group. There is so much misinformation that happens in the internet world that we've got to sort of figure out a way to go through it. And so I do think fear is a legitimate thing. And I think the facts will ultimately win out. And I think science will win out. And I think time is going to be a powerful ally. But fear is a legitimate emotion. When I speak to 80% of people in our congregation, they are fearful. I think the change in the political environment will help as long as things remain positive. But I think fear is a legitimate emotion, particularly for African Americans to emote right now. And I think we need to be sensitive to that.
Thank you all. I'm going to throw this at our doctors. Who should not take it? We got a lot of questions. If you have autoimmune disease, if you have MS, if you have asthma, obesity, are there cases where you should not take the vaccine, depending on your condition?
You want to start?
Yeah, so the only one that I've seen a pure contraindication is an injectable medication where you almost died. I mean, I don't know how to sugarcoat that any other way except to say it. Is an anaphylactic reaction, meaning your throat closed up, you couldn't breathe, and there had to be a whole rapid response to save your life. But all the other things people have been concerned about, is it okay if I'm pregnant? Yes. Is it okay if I had a kidney transplant or a liver transplant? Yes. Is it okay if I have I'm HIV positive? Yes. Is it okay if I have lupus or sarcoidosis and I take steroids? Yes. And I think if anything, for those people, it's more that you should, because your immune system is already suppressed. And I'll just stop there and let Val do the rest about, because people said, but I take steroids, so should I? So I'll let her take the rest of it.
And Val, if you want to cover shingles and flu shots too, if you've had your shingles or flu shot as well.
Great. So in addition to what Dr. Sanford said, I would add, just if you know that you're specifically allergic to one of the ingredients in the vaccines. Yes. So both Pfizer and Moderna, although they work in the same way, they have very, very slightly different ingredients. So in Montgomery County, we're giving the Moderna vaccine, And when people come in to get it at our vaccination site, they are given a consent form, and it spells out all the different ingredients. Most of these are things you've never heard of. And they're things that very, very few people are allergic to. You can always go online too. I think shouldn't be too difficult to find an ingredient list. So if you know you're allergic to something in that ingredient list, then you would not want to take that vaccine. And if you've been recently vaccinated, which is quite likely, particularly if you've gotten a recent flu shot, or maybe you did get a shot for the shingles, the recommendation is to wait at least 14 days from any prior vaccine before you get this vaccine. So that would be the minimum time you want to wait. There's certainly no harm in waiting, 3 or 4 weeks, just to make sure that your body is completely done with that first vaccine before you introduce another vaccine.
Yeah. We definitely had people that had just gotten their shingles. So it's great for us because we have all those things you mentioned that we go down the list. Have you had COVID in the last month? Have you had a COVID vaccine in the last month? Have you had shingles? Have you had flu? For the older folks, did you get your pneumonia vaccine? And the point is, we don't want any side effects from those vaccines to sort of cloud the picture if you're having a side effect from this one. So it's just better to wait. And we rescheduled folks, that came and had that. We're like, okay, you come back in next week and we'll get you.
Yeah.
Well, this was mentioned in one of your answers. We have 2 vaccines. We have the Moderna and we have the Pfizer vaccine. People want to know which is more effective, and can you choose which one you want to take, and how do you know which one is best for you?
I wouldn't say one is better than the other. This is what I will say, because we encountered this a lot. Pfizer is 16 and up. Moderna is 18 and up. And we had a whole lot of big 16-year-olds coming through to get vaccinated. So it's just so important. It's approved for that age group because they tested the vaccine in that many people in that age group and showed that it was effective and safe. So it's not safe for your 13, 14, 15, even if they look like they're 18, it's not. And so we had that conversation several times. The other stuff is just how you store it, and things like that. But I think the biggest salient difference that matters in the community is the age group. Oh, and you could talk about, go ahead.
Yeah, sorry, finish each other's sentences here. The Pfizer vaccine, the waiting period between the first and second dose is 21 days. And the Moderna vaccine, the waiting period between the first and second dose is 28 days. That's just what the drug manufacturer came up with. People often ask if they can pick which one they take. In Montgomery County, at our public vaccination sites, the only vaccine that we've received at our county health department is the Moderna vaccine. So that is the only one that we're offering. It's possible that it may be a private pharmacy or eventually at a doctor's office, they might have the Pfizer vaccine, but at least for us here in Montgomery County, we only have the Moderna vaccine at our health department, through our health department.
And Val, that leads into the next question about the rollout. Can you talk about how you get the vaccine here in Montgomery County? We can add that there's differences between here and Philadelphia and other places because we know there's a lot of crossover. But can you talk about where we are right now in Montgomery County in terms of getting the vaccine from the county, from the public site at the community college?
Sure. So this has been a pretty confusing situation, partly because the rules that Philadelphia is following are a little bit different because they're getting their vaccines directly from the federal government. And the rest of the state, the rest of the 66 counties, we're getting our vaccine from the Pennsylvania Department of Health. And so we're required to follow their directives. So each week we get a supply of vaccine from Pennsylvania Department of Health. It is a very small supply. This week, we got 5,000 first doses and 700 second doses for people that had already received their vaccine. When that comes in, it gets stored properly. There's a whole, what's called a chain of custody to make sure that it's kept at the right temperature and all those things. And we have a website where you can pre-register to get the vaccine. And we send out by email appointment links so that people can sign up to make an appointment. Our biggest problem right now is that we have literally, at least as of this morning, 80,000 people pre-registered to get the vaccine. The county itself has received 17,000 doses. So the demand is way bigger than the supply, and it's been a frustrating situation for all of us, and we really have to ask you for a lot of patience while the vaccine production is ramping up.
Yeah, so, but it's different in Philadelphia. There's some different qualifications in Philadelphia in terms of that. So,
Yeah.
So you may hear from someone this happened, but if it's because they're in Philadelphia.
I can certainly talk about the Philadelphia one if you want.
Sure,
You think
sure. I'm
there's
sure we
people
have
here
some
from
crossover
Philly?
and so people can understand.
Yeah.
Yeah. So in Philly, we are vaccinating 1B people. The 1A is still pharmacies, hospitals, and they did set something up at the convention center. So we were approved to give 1B, and we have a list of what that is on our website, but it's essential workers. So it's SEPTA workers, teachers, restaurateurs, grocery store clerks, people who live in congregate settings and or work in congregate settings, people 75 and over, and people with chronic health conditions. So that means if you're 35, you're overweight, and you have asthma, that's significant risk factors, and you would qualify. Right now, we only get 500 doses per session, and we get 2, so that's like 1,000 doses per week. We have over 16,000 people who have registered. So, you know, it's not a lot. But we have been confirmed that everyone that we give the first dose to, we can give the second dose to. So I was very relieved to hear that. And so we're just working through. The good thing is in Philly, which is also the same Montgomery County people, is people are registering on multiple sites. And so sometimes when we go to let them know it's your appointment, people will email back and say, oh, I was able to get it this place. I was able to get it that place. So maybe both of our lists are overinflated, and that's what we're doing. And for us, again, Philadelphia County, I've recognized with these sort of in the community that we're going to have times for seniors and for people who are disabled. So next week, our 10 to 1 time is going to be 70 and over and physically disabled, because folks need a little more time. You know, they're coming in with walkers, they're on oxygen, they have canes, they have aids, parents pushing their adult cerebral palsy children with intellectual disability, they need more time. And so we can do that as a private, I guess, entity, just deciding that these folks need more time. So that's what we're going to do to take care of our seniors. So.
And I didn't actually fully answer the question, Ken, about it. The 1A category for Montgomery County now includes anyone who's 65 years of age or older,
Okay.
whether or not you have any underlying condition. So 65 or older. And if you're under 65, down to age 18, because we have the Moderna vaccine. So we're vaccinating the 18 to 64 also. If you have to have one of a specific set of health conditions. And you can find that list on our website. And I'm sure the team here can type that website in. So that is now R1A. And that is following the Pennsylvania Department of Health guidelines.
And
I'm so glad you said that. Now all those people will stay in Montgomery County now that they know that. That's great. Please type that in the chat.
Well, just so for everyone's, you know,
takes us
we
to
had 80,000
250,000.
people. Yeah, this morning we had 80,000. I don't know what we're up to by now, but 80,000 people on our waiting list.
And
Right.
I believe that we have 250,000 people in the 1A
We do.
cohort.
So we think when we look at the census and we look at the rates of smoking and things like that, we're estimating that we have about 250,000 people in Montgomery County that now qualify for 1A.
Right. Well,
So we
if
got a long
President
way to go.
Biden gets the production,
That's
people
right.
should still register because they're going to get an
Oh, yeah.
appointment in the order with which they registered, right?
That's correct. So
Yeah.
you should get your name on the list, and
Mhm.
we will move through that list as quickly as we can. There is a commitment by the Biden administration to use something called the Defense Production Act to help additional manufacturers start to manufacture these vaccines. And so hopefully within a month or so, we might see an increase in the availability of these vaccines. But for these next several weeks, we've been told, you know, not to expect much more than what we've been getting. So it's frustrating, but we know how to stay safe. You know, if people wear their masks and keep their hands clean and watch their distance, people can stay safe. And we're going to have to keep doing that for a while yet.
That actually leads into another question that came up quite a bit. Why can't we go back to normal after we're vaccinated? Once you get vaccinated, why do you have to wear a mask? Why do you have to social distance? Why can't you just be footloose and fancy free like Pastor
Yeah.
Mitchell there?
Do you want to answer that, or do you want?
Why don't you start and I'll.
Okay, so basically, you're getting the vaccine stuck in your arm, so it protects you. Period. It protects you. So you generated the antibodies, you generated the immunity. So when coronavirus tries to come in my nose or my eyes or my mouth to get to my lungs, the antibodies prevent me from getting it, or it allows me to have a very mild illness. Now, when that coronavirus comes in my nose, though, if I'm talking to somebody without a mask, or it's in my mouth and I cough or even speak, I can spread it to someone who has not been vaccinated yet, right? So that's why you still have to wear your mask. And the vaccine is 95% effective, both of them, which means there's going to be 5% of people out there that may not generate an immune response. So the whole purpose is enough people either have coronavirus or get vaccinated. That leads to the herd immunity, which decreases the transmissibility in the community. And then you don't have to wear your mask anymore, right? So that's the sort of beginning, middle, and end of it. It is the vaccine prevents you from contracting the disease.
Yeah. Val, you want to add anything there?
No. Thanks.
Can we talk a little bit about the equity issue with this changing of the regulations now for the 1A in Montgomery County? Because I couldn't help hear Dr. Stanford talk about SEPTA employees being vaccinated now in Philadelphia, grocery store employees and all that, where right now in Montgomery County, we cannot do that. And these are the people who have been working on the front lines since this pandemic started, who have now been pushed to the back of the line. And you know, I know we follow the Department of Health guidance on this, but it doesn't make a lot of sense to me. And so maybe someone can help understand why we are pushing these people back now when we don't have enough supply.
Well, I'll start on that. To me, there's not an acceptable answer to that question. The prior administration, that is now out, decided that that is how it should be. I did get confirmation today that that direction was given to our Pennsylvania Department of Health, that we were to adopt these new guidelines as a state. And the state felt that, you know, they didn't have a whole lot of say in the matter. And the problem with this approach is that the original plan, which is the plan that it sounds like Ayla and her team are still following in Philadelphia, did I thought, a good job of balancing getting vaccine to people who were at very high risk because of their age or an underlying condition, or they were very high risk because of their workplace or the type of work that they do, where they're public facing or working closely with people in a hands-on way, perhaps. And it did a nice job of balancing that, because it took both older people, people with certain conditions, and it would have let us vaccinate teachers and postal workers and grocery store clerks and our SEPTA workers, et cetera. And so I can't defend this from an equity standpoint at all. I think it's a mistake. And I am continuing to pursue ways that we can get around this if it's possible, because I don't think it's fair. And the communities that have borne the brunt of this disease and have also kept our world running during this pandemic, when others had the luxury of working from home, in my view, they're the heroes, and they should have been right at the front of the line, right behind those actual hospital and healthcare workers.
Anyone else want to add anything to that?
I think I go back again to what Pastor Mitchell has said in terms of the trust issue. So then when we change the procedure, we put a real efforts around mistrust. So the individuals who were scheduled to get B are now at the back of the line and have no idea when that will happen. And then you have another system in Philadelphia that is much more open. So here again, minority community in Montgomery County are left out. And I don't know how we change that. We change the rules.
Yeah.
All right. What might be the possible long-term effects from the COVID-19 vaccine?
Me, you. So
I'll start and you can finish.
Okay. Okay. Cool.
Again, I think it's important that we just be completely straight with everybody. We don't know yet. The vaccine was developed. So the technology to make this vaccine has actually been around for about 10 years. But the specific vaccine for the coronavirus is new. Remember, the coronavirus was just identified in the United States a year ago, right about this week. So this is a brand new disease in this country, anywhere in the world. And this vaccine was developed to meet this disease. So while the technology is not new, the actual vaccine is relatively new. And as soon as it was developed, the clinical trial started, meaning the testing in human beings started. First, there was some quick animal testing, and then it moved into testing in humans. And I believe it's been about 9 months at this point, I think. Ayla, you may know better, since the first people got the vaccine. So what we have now is about a 9-month history and a shorter amount of history with lots of people. What are called the phase 3 studies were done in 30,000 people. Both Pfizer and Moderna each did 35,000 people. And those folks have had vaccine. It's now been about, I think, 5 to 6 months for a lot of those individuals. So that's our time. That's the history that we have on this. So again, I mean, I think it's important to be really honest about that. We can't answer the question, what's going to happen in 5 years or 10 years? We just don't know.
This isn't a specific vaccine question, but I think it's an important question. Anyone can jump in here. Why has COVID-19 impacted the African-American community to a larger degree than other communities? Why have there been more cases? Why have there been more deaths?
Well, we don't have enough time for that response, but I'll try to give as an abbreviated version. It's multifactorial, okay? You know, in the beginning, the narrative was it's because Black people are sicker. It's because they have more comorbid health conditions, and that's why. And I was always pushing that it's access. It's because so many of us were trying to get tested. And at the time, the message was, don't come to the hospital until you're really, really sick, right? So everybody waited. And by the time they got to the hospital, they were so far gone that the supportive measures, remember, there's no treatment, the supportive measures of oxygen, laying on your stomach, steroids, antivirals, antibacterials, things that we all know help, it was too far gone. I mean, people died at the front door. They died in the waiting room. They never even made it right? So there was an element of that. And that is access. That's health disparities. That's what has existed in our country for longer than most of us have been living, right? Then, yes, there are people who were overweight and who smoke and who have sleep apnea and who have cardiac disease and who have diabetes and had conditions that were undiagnosed, that when they got hit with this virus that attacked your respiratory system, they didn't have a chance because they were already standing on one leg anyway, right? So there was that. So those two things together were a perfect storm, but we had a lot of folks that were healthy and Black and still had these issues. And so where the Black Doctors COVID-19 Consortium came in is because, again, and Val can tell you, when we were in medical school, all this stuff, it was the same thing: social determinants of health, where you live, your educational level, who your doctor is, do they look like you, are they culturally competent? These are all things that impacted your health outcome. Now completely exacerbated because we have this ridiculously transmissible infectious disease that is spreading and loves to live in dense environments, spreads like crazy in multi-generational households, spreads like crazy in face front employees, which many African Americans are, as you already mentioned, those particular professions. And then you add the history and the untrustworthy healthcare system that many of us grew up. And I said to someone, when we grew up, you didn't go to the hospital unless you were about to die. You didn't go. Your mom or grandma had something in your house to take care of whatever you had. So we didn't go unless we needed a physical for school, or you had to go in order to do something you wanted. When you grow up with that, even though there's a pandemic, you're not running. You don't have a relationship with your PCP. So it was all those things. And that's just a little clip of all of it. But all of that was a perfect storm that led to these worse outcomes. But I don't want anyone to feel like, because I felt like in the media, there was a big push to, because they're unhealthy, that's why they're sicker. And that was not the case, because there were a lot of healthy Black doctors, nurses, and just people who weren't even in the healthcare profession that lost their lives to this disease. And so for them, you cannot say it was because they had comorbid health conditions. So that's as abbreviated as I can make it, but it's a multitude of reasons. And the ones we can do something about is what we've been working on in the BDCC. And that's access and advocacy and education.
All right. Pastor Mitchell, you look like you wanted to say something.
That's always the case. Well, you know, I was thinking about the moments during this entire crisis that were definitive for me. And one was when my brother John came to me and said one of his friends died of COVID. And I asked him just to give me the backstory on it. He died in his home and he was found on the floor. He was the primary caregiver for his brother who had ALS. And so his brother with ALS saw his brother, who was his caregiver, collapse and die on the floor, and then he eventually died. And I think part of it is because the brother had no support system who had ALS. The brother who was his caregiver, he ultimately died because there was nobody else in his family or no other care provider around who could stand in the gap for him. And I think of all of these socioeconomically inspired realities why Black people are so fragile in the American ecosystem. There's so many gaps, and so much of it also has to deal, it goes right back to wealth, it goes back to opportunity, and these other big unaddressed things that are gaping wounds in America's history. And when you get moments like this, as Ayla said, with something that's so transmissible, that's looking for a host, it is ultimately extremely destructive. And this is obviously not going to be the last time we have something like this, but when these devastating things come, they naturally find and look for the Black victims because there are so many other things that America has left unaddressed.
All right. Pastor Waller.
Well, I don't think that I can say it any better than Ayla and Marshall have already said it. The reality is when America has a cold, the Black community has the flu. And this is exacerbated by all of the other issues that impact the tragicomic reality of what it means to be Black in America. And so while tonight we're talking about coronavirus, this conversation needs to continue. The equity conversation needs to continue because there's going to be something else. And we'll be back here talking about it again. We have to talk about how government, faith communities, and responsible individuals help Black people totally fit into the American experiment. And that's the larger conversation here. And so we're here tonight to remind the system that they need to treat Black people fairly, and that we need to own the problem of the system and address it, not just coronavirus, but address the larger issues of equity and our people.
And I know I'm taking a second bite at the apple, Commissioner, but I think white America who trusted science listened to Anthony Fauci. Black America who didn't trust anything going on in America listened to Ayla Stanford. And I think that should be very instructive for us. One of the things I saw, Ayla trusted me enough to set up tables and park cars during all of this. And one of the things I did was I would drive around from a location where Black doctors had set up, and several blocks away, and I'm a former University of Pennsylvania trustee, I would go and see Penn set up, and Penn would have as many security guards out there as they had doctors and nurses. And for African Americans who are over-policed, who don't trust systems, and they show up at a place where it looks like a cattle call and you see security guards, we didn't have security guards. You know, we had deacons and trustees and ushers, and we didn't have any problems because there was a cultural fluency that existed. So I think a lot of well-intentioned folks in government, a lot of well-intentioned folks in the academy don't understand how deeply rooted the distrust is for African Americans of even well-intentioned white people and well-intentioned majority institutions. And I think until we begin to peel back that onion, we're going to continue to have trouble.
Well, Pastor Mitchell, I feel compelled to say here too, I was listening to Dr. Fauci. I didn't have any symptoms. I felt fine. Dr. Stanford made me get a test in Pottstown. And I said, I don't need a test because that's when we were short on tests. And she said, I see what you do. I see that you're out there. You get the test. Lo and behold, I came back positive. But, you know, that was because of Dr. Stanford, because I was there and she basically said, sit down, shut up, and get tested, and then called me. So as Val made the point, we're a year into this, right? It was this time last year that we were talking about this. There's so much to be learned still. We've come a long way, but we weren't talking about wearing masks in the beginning. Nobody was wearing a mask in March and April, because we didn't know about the asymptomatic spread. But, you know, that's why Val was pushing for testing. Dr. Stanford was pushing for testing. So we're learning each and every day, but we are running out of time. Let's talk about what we can do about people getting vaccinated. If everyone can just share why, when it's your turn, whenever it's your turn, whenever you have that opportunity to get vaccinated. Pastor Kwan, you're the senior pastor, so I'm going to let you go first, and you are vaccinated now, praise God. So tell the people why they should get vaccinated.
One, I think that we do listen to science, but we also listen to those African Americans who have an interest of us. So when I listen to Pastor Waller and I listen to Pastor Mitchell, that they express all of the concerns, not just in terms of the medical field, but the whole realm of society and this government. I think until we address the whole issue, but I really believe in my heart that I spoke to Dr. Warren Matthews, an African American at Abington Hospital, and he said to me, Reverend, get it. And I had preconditions in terms of health, which I shared before, but I trusted him. And I think, again, the matter of trust is so important and how we convey that. So, and one is ourselves, if we're able to. The second is that people trust us. And there's a mistrust with others who may have other intentions. And I think, again, we heard that tonight. So I think, the voices of those who people trust, and Pastor Mitchell has been on the front line, as well as Pastor Waller. And I think their lives speak volumes about this whole social issue. It's not just in medicine. People trust them, and I trust them, but I'm not the only one. So again, I think, our voices have to be collectively heard together. But I do believe that people do trust us from a Black perspective, because we're not just talking one area. We talk about holistic life and all the other kinds of factors that take place.
Pastor Waller?
Yes, I think that we all need to approach this with an understanding that there's a lot we don't know, but we're fighting for the future. We're fighting for the future of our children. We're fighting for the future of the human experience. And so we need to listen to science. We need to recognize there's a lot of this that we will not know or understand, but it is worth the risk of doing it so that we can eradicate it. And so I'm committed to staying in the conversation, but also challenging the system to be truthful and transparent throughout the process.
Look, we're fighting a war. And when you're fighting a war, you've got to use every weapon at your disposal. Mask, washing hands, social distancing, canceling church in person, doing things differently. And so I'm committed to it. My mother has received the vaccine. She listens to Dr. Stanford. She listens to me. And I think people have to make up their own mind about when it's right for them and when they feel comfortable doing it. But I would just tell people, exercise your faith, even in the context of all the fearful things that are happening.
Yeah.
Val?
So this is an easy answer for me. I don't want any more people to die. So as many of you may know, I'm the spokesperson for the county on this issue. And every week, every Wednesday at 3, actually, we're moving them to 1:30. So every Wednesday at 1:30, if you're interested, we do a press briefing. It's streamed on Facebook. And week after week after week, I have to talk about how many people have died. Today, just from yesterday to today, we had 15 Montgomery County residents die from COVID-19. So I know that we don't know everything about this vaccine, and I won't tell you that we do. We don't know for sure how long it lasts. So far, it's been safe, but as I said before, we don't know, 5-10 years from now, because it hasn't been around that long. But what I do know is that our friends and family and neighbors are dying from COVID, and I just don't want anybody else to die.
And Dr. Stanford, you have been on the front lines since literally the beginning on this, and in the communities, first getting people tested, continuing to get people tested, and now getting people vaccinated. Talk to the African-American community about why it is important to not miss your shot when you have that opportunity to get vaccinated.
I mean, quite frankly, right now, there's not a lot. There isn't enough. And I wish that I could vaccinate every single person, period. But even the people that meet criteria, there's not enough. And I have people, the emails of, my mom, I registered, my mom died last night from COVID. Can I get on the list earlier? I'm HIV positive and I registered and I got an appointment, but I can't get off work. Is it possible I could come sooner? I have stage 4 breast cancer. Where am I on the list? Do you think I could come? And every single email, it's rare that I get someone who really shouldn't be even asking. Like, these are all legitimate reasons. And so what I'm saying is, I don't want you to miss your opportunity while we have it. Keep having the conversations, get your questions answered, but don't take too long, because when it's gone, it's gone. And Black people are the ones who have been impacted the most from this disease in terms of the rates of death and the rates of disease, of people that are no longer in our families, people who are breadwinners, leaders in our communities are lost. I mean, honestly, I would like to see how the percentage of African Americans in this country decreases after this pandemic. It was at 13%. I'd be very curious to see where we are after. So please just don't miss your opportunity. Be careful who your sources of information are, not random people because they have 200 followers on Instagram. You know, make sure they have a degree, make sure their reasons are founded in science. And if you make that choice and that's your choice, then you stick by that. But your choice shouldn't impact others. Just make sure you are informed. And I was scared. I was really scared about the vaccine. I cried about it. I prayed about it because I had COVID and I was like, I have antibodies. I'm not taking this vaccine. I don't know enough about it. And there were so many people who said, well, if Dr. Stanford's not taking it, I'm not taking it. And it was such a heavy weight. And I decided that I wasn't going to be afraid, so maybe you wouldn't be afraid. And that's why I did it. So maybe it would lessen your fears, knowing that I'm a wife and I'm a mother and I'm a leader and I'm a daughter and I'm so much to so many people that I wouldn't put something in my body that I thought would take me away from them. And know that. And that's as much as I can give in addition to everything that I've already given during this time. So that's what I would say.
I want to thank each and every one of you for your transparency tonight, for your candor, for your caring. I want to thank you not just for this hour tonight, but each and every person on this panel put so much into our community 24/7, each and every day. Sorry we couldn't get to all the questions. We will look to try to get answers for folks. And I believe this won't be the last time that we do this. We've got other issues to talk about now, but I appreciate everyone who has tuned in tonight. And thank you again to our panelists. Stay safe, be healthy.
And before we leave, can I express on behalf of the faith community a deep appreciation for Val, for yourself, Ken, and for Dr. Stanford. It's amazing how we have come to the point that so many individuals are giving their lives. As you said, if we can save one life, you talk about all the things that you've done because of your own commitment to your mother and to your family. It's incredible. So thank you so much.
Thank you. All right.
I'm having a vaccination party Memorial Day weekend. I'm just saying. If you've been vaccinated, you can come. I'm just putting it out.
I might be there for my second one.
I'm gonna put a big sign on my yard so people know when they see all the cars, vaccination barbecue. And if you haven't had it,
what if you have natural antibodies?
I was thinking about that, but I'm gonna call it vaccination barbecue because we don't know what your levels are. We don't know how protective you are. I'm gonna call it vaccination barbecue. I need something to look forward to. Everybody needs something to look forward to. So I think that's important. So that's my something. Anyway.
All right, everyone. Stay healthy. Bye. Be safe.
Thank you.
Bye.
Bye.
Top of the morning to you.